Hey everyone, welcome back. Ready to dive into something kinda strange.
Always up for a challenge. What do you have for us?
We're looking into sunset eyes today.
Sunset eyes.
Yeah, it sounds poetic, almost pretty, right?
It does.
But it actually can point to some serious medical issues, especially with the brain.
Oh, okay. That's less poetic.
Right.
Yeah.
So some listeners sent over these excerpts from a medical text about it. They called them setting sun eyes. So we're going to unpack that, primarily focusing on how it relates to hydrocephalus.
Okay. Sounds good.
Basically, we're taking a deep dive to help you quickly get the key info on this pretty complex topic, and hopefully we all learn something new along the way.
I'm ready to learn.
So to start, listeners sent in info that mentioned this kind of distinct downward gaze that people with this have, where their pupils are partially hidden by their lower eyelids.
I'm trying to picture it. It sounds a little unsettling.
It does sound a bit creepy when you describe it like that.
Yeah. It's definitely striking visually, and I can see why it would be a little unnerving. But you're right. To focus on that gaze, it's often a critical warning sign.
Almost like a check engine light
Exactly.
for your brain.
Yes.
Right.
Like your internal systems are saying, hey, pay attention to this. It often indicates a buildup of pressure inside the brain, and that pressure. Well, that's something doctors definitely don't want to see, especially in babies and young children.
So we should be concerned if we notice this.
It's definitely something that shouldn't be ignored. And in infants in particular, it could be an early indicator of hydrocephalus.
And hydrocephalus is something we definitely want to unpack more as we go. Now, the material you sent over did mention hydrocephalus as a potential cause of those sunset eyes.
Right.
But for those of us who haven't, spent years in med school, can you give us the quick rundown on what hydrocephalus actually is?
Absolutely. You might have heard it called water on the brain,
Yeah, I've heard that.
which, let's be honest, is a pretty vivid and kind of scary way to describe it. But essentially, it's a condition where cerebrospinal fluid, or CSF, builds up excessively in the brain.
Okay, so CSF, that's the fluid that cushions and protects the brain.
Right, you got it. CSF is like the brain's own personal bubble wrap. It acts as a shock absorber, and it also helps transport nutrients and remove waste products.
So it's pretty important stuff.
Essential. But the key is that this fluid needs to flow freely. If something disrupts that flow, whether it's overproduction of the fluid, a blockage somewhere in the system, or a problem with its absorption, you get this buildup, and that's when the pressure inside the skull starts to rise.
Okay, so the brain's like this delicate ecosystem.
Exactly.
And this fluid needs to be circulating properly for everything to function as it should.
A perfect analogy. And what makes hydrocephalus even more complex is that it's not a one-size-fits-all condition.
Oh, really?
Oh, yeah. It can be congenital, meaning it's present at birth, or it can be acquired later in life due to injury, infection, or a bunch of other factors.
It's wild to think that something like fluid flow can have such a visible impact on our eyes.
Yeah, it is pretty incredible when you think about it.
But then again, I guess the brain is connected to everything, so.
Yeah, exactly. It's like the central hub controlling everything. And in the case of hydrocephalus, that pressure we were talking about can directly impact the areas of the brain responsible for controlling our eye movement,
Oh, okay.
which can lead to those fixed, downward-looking eyes, the sunset eyes.
And the info you sent over mentioned that a lot of kids diagnosed with obstructive hydrocephalus have sunset eyes too.
Right. Which makes sense given what we know about the condition.
Yeah, it really highlights the connection from you.
It does, for sure. But it's really important to remember that in medicine, just because two things happen together doesn't necessarily mean one causes the other.
Oh, interesting.
Yeah, correlation doesn't equal causation, as they say. So while hydrocephalus is often behind those sunset eyes, especially the kind that sticks around, it's not the only possibility, you know?
So even if you see a child with this downward gaze, it's not a surefire sign of hydrocephalus.
Exactly. There could be other things going on.
Okay, so what else could it be then?
Well, even perfectly healthy infants can have sunset eyes sometimes, and it's totally temporary.
Really?
Yeah. Remember how we were talking about CSF flow? Well, in newborns, that whole system is still maturing. Sometimes that leads to these brief fluctuations in pressure that might cause their eyes to look downward for a bit.
Huh. It reminds me of those old wives' tales about babies not being able to see when they're born.
Right.
Obviously, babies can see, but their vision does develop over time.
Exactly. And this temporary sunset eyes thing, it usually resolves on its own as their nervous system matures, usually before they turn 2.
Oh, wow. Okay.
It's a good reminder that not every instance of sunset eyes is a reason to panic,
That is reassuring, but I'm guessing it's always better to be safe then sorry, especially with little ones, right?
100%. Anytime you're concerned about a child's eye movements, or if you notice a persistent downward gaze, talk to your doctor.
Makes sense.
It's always better to get things checked out. Early diagnosis and intervention can make a huge difference, especially for something like hydrocephalus, where early treatment can really improve outcomes down the line.
So, since we're talking about treatments, you mentioned that sunset eyes themselves are a symptom, not the actual issue, right?
Right.
So it turns out hydrocephalus is the root cause. What are the treatment options for that?
Well, the main goal is to manage that CSF buildup, to relieve the pressure on the brain. There are two main surgical approaches: endoscopic, third ventriculostomy, or ETV for short,
Okay.
and then there's shunt surgery.
Those sound pretty intense.
They are. It's brain surgery after all,
Yeah.
but they're often very effective.
So walk us through those. What do those surgeries actually involve?
Sure. So with ETV, the surgeon uses an endoscope, which is like a tiny camera, to create a small opening in one of the brain's ventricles.
Okay.
Ventricles are like little reservoirs that hold CSF.
Got it.
Creating this new opening gives the fluid an alternate route to flow so it can bypass any blockages, and that helps reduce the pressure.
So it's like creating a detour around a traffic jam, but for brain fluid.
Exactly. That's a great way to put it. Now, shunt surgery, on the other hand, that involves implanting a thin tube, called a shunt, into a ventricle in the brain. This tube is then tunneled under the skin, usually down to the abdomen, and that allows the excess CSF to drain away from the brain.
So it's basically like rerouting the fluid.
Exactly. It's pretty incredible what neurosurgeons can do these days.
It is. They can essentially replumb the brain's plumbing system.
Yeah, it's really quite remarkable.
Both of those sound incredibly delicate and precise. They are. It's brain surgery we're talking about.
Yeah, it's not exactly a walk in the park.
But for those who need it, those surgeons are miracle workers.
I completely agree. They can achieve some pretty remarkable things. And, just to clarify, if those sunset eyes are related to what we were discussing earlier, like the temporary developmental stages in infants, treatment might not even be needed.
Ah, okay.
Yeah.
So it all boils down to figuring out the root cause.
Exactly. Is it normal for this particular person at this particular time, or is it a sign of something that needs medical attention?
It's like you said earlier, correlation doesn't equal causation.
Right. It's about looking at the whole picture.
This whole deep dive has been really eye-opening, pun intended.
It really has.
It's amazing how much we can learn from something as simple as, how someone's eyes look.
It speaks to just how interconnected everything in the human body is, Even the tiniest thing that's off can give us clues about what's happening internally.
It really does make you appreciate the complexity.
Absolutely.
So for our listeners who are maybe a bit concerned about sunset eyes, especially with their own children, what's the key takeaway you want them to have from all of this?
If I had to pick one thing, it would be this. If you notice sunset eyes, particularly in babies or young children, don't hesitate to reach out to your doctor. It's always, always better to err on the side of caution.
Yeah.
Yeah, sure, there are benign explanations, but it could also be a sign of something that needs to be addressed sooner rather than later.
Like hydrocephalus.
Exactly. And in those cases, early diagnosis and treatment can dramatically improve outcomes.
It can literally make all the difference.
Absolutely.
Well, this has been an incredible journey. We started with a term that sounds kind of poetic, sunset eyes.
Right.
And we ended up talking about the complexities of the brain and fluid dynamics and even neurosurgery.
All because of a curious listener.
Yeah.
It's amazing what you can uncover when you start digging deeper into these things.
And that's what the deep dive is all about. So to everyone listening, thank you for joining us on this exploration into the world of sunset eyes. We hope you found it as fascinating as we did. Until next time, keep those minds curious, and we'll see you on the next deep dive.